June is Scoliosis Awareness Month, and according to the National Spine Health Foundation, scoliosis affects millions of people worldwide. And this morning, Dr. Matthew Geck from Ascension Seton, Texas Spine and Scoliosis joins us to discuss the condition. Dr. Geck, thanks for being here.
Yeah, thank you for having me.
Hope you can just start us with the basics. Explain to us what is scoliosis and some of the symptoms associated with it.
Oh, sure. So scoliosis is an abnormal curve in the spine. And it's usually the most common kind is idiopathic scoliosis, and it starts in adolescence. But the reason we're so interested in this disease process is it has implications for health, physical well-being all through a person's life. So we're always trying to detect it early so we don't have to treat it late.
You mentioned that it starts early in adolescence. Can you talk about how scoliosis impacts children versus adults?
Sure. So in children, the most common impact is that they have a physical deformity. That's usually the thing we notice. Asymmetry in shoulders, asymmetry in ribs, asymmetry in waist. And the physical deformity is often what brings them in, but there's also a real medical case for why we should treat scoliosis. It's not just the physical deformity, it's also the health of the lungs and the long-term health of the low back.
So by having this deformity in the spine, it actually impacts your organs and some other things?
Absolutely. So a bad scoliosis in the rib-bearing part of your spine can affect your lung function, and that has long-term implications for your cardiovascular health.
Yeah. And can you talk about just the treatment and treatment options and what you suggest to to your patients?
Sure. So I always want to see, especially kids, early in the process, because if we can brace them out of a scoliosis, that's always a win. And even if we can't brace them, let's say the curve has progressed despite a brace, there's also new treatments that preserve motion, like vertebral body tethering, that let us cure the scoliosis without the fusion operation. Now, the fusion operations have become really, really good, very reliable, but if you can preserve motion, that's sort of obviously always a win, too, for patients.
Yeah, and I guess just can you talk about how common is this, and is this something that parents would immediately recognize in their child, or what age is it typically detected?
Yeah, that's a great point. So about 1% of girls have a treatable scoliosis, and it's less boys than girls, but physical deformity, so parents noticing, is about half the time what brings kids in. The other half is the school noticing at a school screen or their pediatrician noticing at a well visit. But it is noticing those small asymmetries in the back that often triggers the child coming to see us.
So sometimes it's not obvious, is what it sounds like.
Right, it can be very subtle. Some of these differences are subtle, which is why school screening is sometimes, or even screening in our office, we offer screening visits. Sometimes it's just looking at everything, an experienced eye looking at the back to make sure that we don't need to check an x-ray.
All right. Dr. Matthew Geck, talking about scoliosis with me. Thank you so much for your time.
You betcha. Thanks for having me.